Hi, my name is Andrew Ryan. I'm the Executive Director of Care Plus Home Health, and I'd like to welcome you to another episode of Better Care, Better Health series. I'd like to welcome my guest and a friend of mine, Ms. Sheila Griffith. She is the Program Manager for the National Capital Area Chapter of the Alzheimer's Association. Sheila, thank you for joining us today.
Good morning, Andrew, and thank you for having me. We're excited to be part of this programming.
Thank you. So to start, my first question would be, tell us about Brain Awareness Month and the Longest Day efforts.
Well, thanks for asking. So at the Alzheimer's Association, as you probably know, our mission and our vision is a world without Alzheimer's disease and other dementias. So one of the things we need to do often is to try to reach out to different communities to talk about brain health, brain awareness, and obviously June is the perfect month to do that. So many of you have heard we do a lot of fundraising at the Alzheimer's Association for research. And so our June fundraiser is called The Longest Day. And so we focus on June, and the longest day, it's June 20th, the solstice. And it's a day that you can target that day and spend that day doing anything you like. What we say about the longest day is try turning your passion into a purpose by helping to raise awareness and funds for the Alzheimer's Association.
The longest day is the day with the most light, the summer solstice. On June 20th, help us stand up to the darkness of Alzheimer's by raising funds for the care, support, and research efforts of the Alzheimer's Association. It's easy. Pick any activity you enjoy and turn it into a fundraiser to fight Alzheimer's. Together, we can get closer to our ultimate goal, the first survivor of Alzheimer's. The day with the most light is the day we fight. Start now. Select your activity at alz.org/thelongestday.
I know working with you as a volunteer, things have definitely turned upside down for the Alzheimer's Association, the same for all of us in healthcare. What has changed for you, and how have you adjusted with the way things have gone with the COVID-19 pandemic?
Well, we've all had adjustments, and we're all, many of us are in a business where we're working person to person, in person, with seniors and with others, as you know. And so it's been very difficult to be isolated right now. And instead of in-person outreach and awareness, everything has become virtual. So we've really been able to pivot well and transfer a lot of our programming and our resources to virtual. So as an example, this is an example today that we're doing this virtual discussion. We do a lot of education programs about Alzheimer's disease and other dementia. And so this has all become virtual over the last, now more than a year, right? 14 months or so. We've presented many programs to many people in our community talking about Alzheimer's disease and dementia, and in some cases, how to live with the disease and how to do your best to prevent the disease. So, but in addition to education, we offer a lot of resources, specifically caregiver support groups. So those groups used to meet in person in places like libraries and senior centers and assisted living buildings in some cases. And so now everything is virtual again. So we are still able to work with our caregivers, offer them the support and the knowledge, and sometimes it's just the shoulder to cry on, and it's virtual at this point. But we do hope to in the future have more of a hybrid sort of options. So if some groups want to meet in person, in the local library, go back to that, they can. But we know that this virtual support groups have been a real success for us, very popular, and we keep some sort of virtual programming for sure. And you know this as one of our volunteers for the Alzheimer's Association, but we have the other side of the coin from our caregiver support group are our memory cafes. So we have several memory cafes in Montgomery County, and we are using the virtual platform for those as well. And so we do programming like sometimes it's just discussion, sometimes it's education about the disease, and other times it's pure fun. It's music therapy or different types of activities offered through our memory cafe for those with a memory impairment. So we've done a lot virtually. it's
Right.
it's been a long pandemic, but I think we've been able to really help continue helping our caregivers and those with the diagnosis of Alzheimer's or dementia.
Sheila, I have another question about finding the right support group. I know I was a family member many years ago in my early 20s, and it was a matter of finding the right fit. Can you tell us about the different types of support groups that are out there and giving guidance to someone who's just getting started looking for a support group?
Yes, great question. And you're right. That is the point of our support groups. We have many of them. And as I said, they are virtual now instead of in person. And we can really tailor it to your availability, of course, the time of day, day of the week, but also the type of caregiver you are. So our caregiver support groups, some are open to any caregiver. It doesn't matter. And if the time and the date are good for you, then that's a support group for you to try. But if you're somebody who maybe is younger, we have a support group that we call the sandwich generation. So it's people who are maybe in their 40s or even younger, and that they have children at home and they're caring for a parent or a senior who has Alzheimer's disease or dementia. So that group really focuses on that person, that type of caregiver, and some of their issues can be really unique in that situation with young children at home plus a parent or older adult. But other support groups we run are for spouses of those with an Alzheimer's disease or dementia diagnosis. More groups are for adult children who are not necessarily the sandwich generation, but are adult children, and those needs and some of those conversations can be a little different than, say, with the spouses group. So, but as I said earlier, all of our groups are open to anyone, but you can get a real focus on your support group too if you'd like. So the best way to do that is you can contact me through the National Capital Area chapter. So again, my name is Sheila Griffith. I'm the program manager for Montgomery County and Washington, D.C. And if you'd like to contact me, I can even sort of walk you through all of the groups and try to help you find the best fit.
And I know with many of the families that we work with, I often direct them to the Alzheimer's Association as a great resource. Is the website still the best place to find where the support groups are being offered? Because I know I often say look for the best time that works with your schedule. Would that be the advice you would offer to a potential family member?
Yeah, that's great advice. I'm glad you do. So still have people go to our website, which, as you said, is alz.org. And for our chapter, which is here in our area, the Washington, D.C., Montgomery County, Maryland, Prince George's County, Maryland, and Northern Virginia, we're called the National Capital Area chapter. So it's alz.org/NCA. And under that heading, you'll find really everything. You can find online education, you can find these virtual support groups, you can find the virtual memory cafes, but there's other resources also. If you are looking for a physician, if you're looking for an assisted living, if you're looking for almost anything, we have a community resource finder that actually helps direct you, gives you lists of places in your area based on your zip code that could be available for you as a resource. So yeah, our website is always a great option, and we have a 24/7 helpline as well, and that is listed on our website, but I'll let you know it's 800-272-3900. And you can call that helpline, as you know, anytime 24/7 and ask a question of the Alzheimer's Association. So the phone is answered by a master's level clinician who is there to take your calls and offer advice. Sometimes it's a question from a caregiver like, all of a sudden my loved one won't eat. We're here home together, and it's never been a problem before, but they won't eat now. Or something, maybe my loved one is waking up in the middle of the night now and trying to sleep all day. What should I do? What are some of the things I can do? So these our helpline people can offer advice. In some instances, if it get local resources, they would then to myself, a program manager here in Montgomery County in Washington, or maybe one of my colleagues. So I have colleagues in Northern Virginia in our chapter, as well as I said, Prince George's County, and actually Southern Maryland too is part of our chapter. So we're a big chapter and really have a lot of outreach.
Thank you, Sheila. Last question I have for you. The training that we provide for our professional caregivers, it focuses on engaging or life enrichment activities for them, elopement risks, behaviors, and redirecting. I know the Alzheimer's Association offers some great training programs, or they used to, in person for family members. What are some upcoming programs that people can look at for other resources?
Well, that's a great question, Andrew. Thank you. And so you're exactly right. The professional caregiver has to be aware of all of those topics, from wandering to, communications, to behaviors and communications. Caregiver, the unpaid care member, can also have some education in that regard as well. So what we do to provide the education, we have an e-learning page, it's called, where you can just download a program about behaviors of Alzheimer's disease. So all of a sudden your loved one is not acting like themselves anymore. They've maybe got the diagnosis, but they're coming up with these different behaviors. Like maybe they're trying to leave the house when they shouldn't, or maybe they're, not eating when they used to eat very easily. So that's a great program about behaviors of Alzheimer's disease. There's another one about effective communications and how communications changes when somebody has Alzheimer's disease as they move through the progression of the disease. So you can log on to our website, either download this e-learning where you can actually see a specific program about Alzheimer's disease, or you can actually for a webinar. So we have many of these programs I just mentioned, we have as a virtual webinar. So it could be like tomorrow at noon, you just register for it and get a Zoom link. And then it's either myself, a program manager in my chapter, or one of my colleagues. We actually do the program, and we take questions live as we do the program too. So sometimes I can tell you that the program itself goes off and is fine. And it's really, we leave a lot of time for the questions at the end, because caregivers, in some instances through this pandemic that we're still in, the caregivers are really under stress and really have a lot of questions about feeling like they might not be doing well in their caregiving, or feeling like they should be doing more, or questioning what they could be doing. So there's a lot of questions, and I think that's one of the benefits of tuning into a live webinar like that, is that you get someone you can actually ask these questions to and have a conversation.
Absolutely. And last but not least, for the walk, the Alzheimer's walk, I know they had them often in October. Is there a scheduled date for this year that's up and coming?
Yes, there is. Thanks for asking. So the walk for our area, for the Montgomery County, Washington, D.C. area, is October 9th, and we are walking this year. So last October, during the pandemic, we walked in our neighborhoods in small groups. I don't know if everybody remembers, but it was pre-vaccination, but where we were feeling a little brave, at least if we had our PPE and we were outdoors, we all felt pretty good about it. And it was a good way to get exercise. So we walked in 2020, but just in our neighborhoods in small groups and within our families. But now this year in 2021, we hope to go back to probably not our giant walk in Washington, D.C. We had always been at the mall, at the National Mall, and had thousands of people. So I'm sure it won't be maybe everything that it was in the past, but we're slowly coming back to that. But we are walking in person this year. So we're excited about that. And that's our biggest fundraiser. We have many throughout the area here. So we do a walk in Prince George's County. The one in Washington, D.C. is for Montgomery County and Washington, D.C. And we do several in Northern Virginia. And they're all over, and wherever your area is, you can join one. And again, go to our website, alz.org, and you can find the walk near you.
Sheila, thank you so much for your time. It's a pleasure to serve with you as a volunteer and to help the Alzheimer's Association out however we can. Thank you again.
Thank you, Andrew.